What is a charge nurse? There are a lot of things that charge nurses are, so let's talk about them. First of all, depending on where you work, your charge nurse is going to have different responsibilities, but in the majority of hospital settings, there typically is a charge nurse that is assigned to each unit or to a group of units. You'll have to let me know what your charge nurse does at your hospital because I have seen just so many different things, and so we're going to touch base on a bunch of them. I do charge nursing in the ICU that I work in, and we actually have two types of charge nurses. One charge nurse does all of the staffing. They take a look at patients that need to come into the ICU and place those patients depending on where's the best spot for them, which nurses should take those patients, as well as the patients that are going out of the ICU. This charge nurse also will do the staffing for the next shift. So if it's a day shift charge nurse, they will look at what it's going to be like for the night shift. Do we need more nurses? Do we need less nurses? What's the census going to look like? I feel like this is a pretty common job for most charge nurses to do some sort of staffing for their unit or units. The charge nurse role that I do is I oversee all of our nurses. I respond to codes, rapid responses, help nurses if they have any questions, need troubleshooting, need just an extra set of hands. I keep track of the patients that are going to be coming into the ICU as well as out of the ICU, and I coordinate with the other charge nurse to make sure that we are staffing those rooms appropriately. I bring any issues to that charge nurse's attention, as well as address issues if there's anything that comes up between patients or families. At some hospitals, charge nurses will also take an assignment, meaning they will have patients themselves. I do not, fortunately, have to do that where I work. A charge nurse should be a resource for you. A charge nurse should be a leader. A charge nurse should be approachable. I know not everybody gets those things in a charge nurse, and I'm sorry. I know that a good charge nurse really can make bedside nurses feel supported and heard, and like no matter what happens throughout the shift, like your charge nurse has your back. And I also know the opposite side of that as well. Sometimes charge nurses will be responsible for covering lunch breaks or auditing things. Sometimes they're responsible for running rounds or at least being a part of rounding on all of the patients. And typically your charge nurse is going to be someone that has more experience than the average person on the unit. This is someone that should be pretty proficient on their unit with whatever nursing skills are required for that unit. They should know policies and procedures and how to find information if they don't know an answer to a question. So hopefully that covers some of the roles and responsibilities of charge nurses, and let me know what your charge nurse is required to do or responsible for at your hospital.